Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Alpha blockers. Alpha blockers are competitive antagonists against alpha receptors. They are reversible and irreversible. So first we will see the pharmacokinetics of alpha blockers. Alpha blockers are well absorbed and they have high first pass metabolism is present. High hepatic first pass metabolism is present. So these are short acting with prazosin having the short half-life of around 2 to 4 hours, whereas the half-life of phenoxybenzamine is around 24 hours. So these will act on Huffman's elimination. Then they have poor oral bioavailability and the food reduces absorption of alpha blockers.
thank you and thank you for watching.